Good Thursday afternoon. I am Charity Menifee, Director of Communicable Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to those making safe spring break plans to incorporate the 5 core actions. We are also thankful that we live in an area with many staycation opportunities. If you're looking for some fun ideas for your family next week, check out the video series Mayor Jacobs is doing with Visit Knoxville. They are highlighting places like Zoo Knoxville, the Muse, and Knox County's many greenways and hiking trails. You can find those videos on the mayor's social media platforms. Today, we are publishing our data at 1 p.m. so we can provide some context behind one of the figures during today's media briefing. We recently became aware of a process change at the state that resulted in us not being directly notified of some COVID-related deaths in Knox County that occurred over the previous months. We want to be clear that this is not unique to Knox County. You may have seen in the news last week in Davidson County that the Metro Public Health Department identified nearly 300 death discrepancy between their data and the state data. Those deaths were reported at the statewide level, but not at the local level. So this is something that occurred in other metro regions across the state, not just Knox County. Here locally, there are an additional 44 deaths that we were not originally notified about. All of these deaths occurred in December, January, or February, when there sadly was a large winter surge of COVID-19. These deaths were properly investigated by the State Medical Examiner's Office and counted in the statewide total. But because we were never notified about them, they were not included in our total until now. Before we move on, we want to remind everyone that historically, mortality data is not reported in real time. Typically, it takes a year or more to compile this type of data. But because of the real-time nature of the pandemic, data is published at a much faster rate. That's why our team continues to review all of our data to ensure that any inconsistencies can be addressed and fixed in a timely manner, which is what happened here. And also, before we move on to the benchmarks, we want to provide a quick update on vaccines. More than 120,000 vaccinations have been given in Knox County, meaning nearly 17% of our folks in our community have some level of protection. Knox County continues to lead the big 4 metro counties and the percent of population who is fully vaccinated. That is something to be proud of and is a testament to the great partnerships between Knox County Health Department, hospitals, and our other medical providers across the county. We are with an expected increase in vaccine supply over the coming weeks and additional providers coming on board, we are moving in the right direction. Here at KCHD, we are eagerly looking forward to start offering vaccines at the Broadway site tomorrow. This location allows us to have a large space to regularly and consistently provide vaccines to our community. This is incredibly important when you consider second doses. This space will enable us to easily schedule second doses either 21 or 28 days after the first dose we administer. All of the vaccination opportunities at the Broadway site will be by appointment only. Folks should sign up on our wait list to be notified of these opportunities. If you are on the wait list, you will hear from us via phone call or text message when it is your turn. These texts or calls could come any day of the week, so please respond in a timely manner so that we can confirm your spot and get you an appointment made. We will be providing an opportunity for our media colleagues to come get video and pictures as well as an interview at the Broadway location next week. Once we firm up the details, we will let you know what they are. Now, moving into the local situation. We have 60 new confirmed cases since yesterday's report. 1,063 of those are active cases. 40 Knox County residents are currently hospitalized. And sadly, we have 2 additional deaths to report today, raising our total to 593. And that does include the 44 additional deaths that we previously spoke about. We want to take a minute to recognize the decline of active cases and hospitalizations. These numbers over recent weeks are very encouraging to see. Back in December, we were seeing hospitalizations well over 100 and active cases topping 5,000. Today, it's a fraction of that. This is incredibly encouraging and proof that we are moving in the right direction. That said, we want to remind everyone to please keep up the 5 core actions so we can continue making progress. As we said earlier this week, just like a marathon runner doesn't stop in the 24th mile, we can't stop practicing these tried and true measures when we have come this far. Now, we'll turn to the benchmarks. All of this data that we're going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. Over this time period, we saw daily new cases drop to approximately 58 cases per day, down slightly from the last reporting period. The average number of cases over the past 7 days was 59. It's important to note that we are seeing these figures leveling off to more of a plateau. We want to see these numbers decrease and not level off. So we continue, again, we can't say this enough, to urge folks to practice the 5 core actions and get vaccinated when you're able to reduce the spread of disease in our community. Because of all these factors, though, we are representing this benchmark as green. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding testing, we continue to see this figure trend down. During this time period, an average of 750 tests were performed each day in the community, which is down slightly from the last reporting period. Regarding lab turnaround time, this number continues to be consistent at less than 2 days for the community. Because of these factors, we are representing this benchmark as yellow. Our third benchmark, sustained or increased public health capability. The goal is to increase vaccination distribution across the county. Over the past 7 days, more than 2,000 vaccines were given each day for a total of more than 14,000 vaccines administered in a week. This week, we're representing this benchmark as yellow. We are still heading in the right direction, but we recognize that demand for this vaccine continues to outpace the supply. We are hopeful that vaccine availability will increase in the coming weeks with more providers coming on board and expected increase in vaccine supply. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. During this time period, we have continued to see hospitalization numbers decrease. This is encouraging and something we hope to see to continue. After speaking with our hospital partners, they have recommended that this benchmark be represented as green. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. During this time period, we have seen 14 deaths associated with COVID-19, which is down from 20 last week. And in the last 7 days, there were 5 deaths reported to KCHD. This is trending in the right direction, and we want to see it continue. The information available leads us to represent this benchmark as yellow. Under our supplemental data section, the first chart shows newly daily COVID cases per 100,000 population. As of yesterday, our 14-day trend line shows 12 new cases per 100,000, and our 7-day trend line shows 13 new cases per 100,000, both are which are consistent with last week, and that goes along with the plateauing that we talked about before. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 9.41%, which is slightly down from last week. I'll now open it up for questions.
All right, as a reminder for media members that are a part of our Zoom briefing, you may go ahead and submit your questions now. From Claire with WUOT, asking how many people are currently on KCHD's vaccine wait list, and we can get you an updated number for that, Claire. We just don't have that right now at our fingertips. Also from Claire with WUOT, tomorrow marks 1 year since the first case of COVID in Knox County. Thinking back on that day, do you think KCHD anticipated or was prepared for the year that followed?
Yeah, I think the easy answer for that is no. I don't think there was any way that we could have fully known what all the year had in store for us. with the amount of cases and deaths that we've seen, and all of the different things that have come with the 5 core actions and all of those things. But I can tell you that I'm extremely proud of the response from our team, even though that this has been polarized. There's a lot of polarization and a lot of challenges that came with this year. We are so proud of the team that we have and the work that they've done, and they've stepped up in ways that we could have never, ever imagined. We've seen the best of our team over this year, and we remain committed to our community, and we'll continue to work through hopefully the end of this pandemic and through the recovery process that we'll hopefully be seeing very soon.
The next question we have is from Allie with Knox News. How are you feeling after the District Attorney General announced her office will close its investigation because KPD found out there was no criminal activity?
We'll have to, somebody's giving, I actually learned about that literally a couple of minutes before we walked in here, so I know nothing about that. Haven't seen the report at this time. I'm glad the investigation's closed, but can't comment further at this point, given that I haven't seen it yet. We'll follow up with that as we can.
Yes, and I see there's a couple more questions there as well. So yes, same answer for those as well.
Guessing that's what the talk was in the room earlier. Okay.
Also from Allie with Knox News, what is turnover like on the wait list? Are people calling to cancel their appointments if they got vaccinated elsewhere, or is this still an issue?
It still remains an issue. Some folks are doing it, and thank you very much, and please continue to do it. But we still have a whole lot of people that when we call, either they're not responding or we're finding out they were previously vaccinated. So it still remains a challenge. So we do continue and hope that our partners can help to push that message out as well, that folks do continue to call us if you have secured an appointment somewhere else, so we can get you off of that wait list.
And I just received the number of entries that we have on our wait list right now. It's a little more than 34,600 entries total on the wait list currently.
Thanks.
From Vincent with Knox News. In light of the 44 missed deaths, could you please provide updated monthly totals for the deaths we've seen over the course of the pandemic after the press conference?
Yeah, I can tell you right now, I have in front of me, December was 153, January was 179, February was 62, and March thus far has been 12. So again, you can see that the real burden was in December, January, which is when we saw our surge in cases as well.
And Katie, I see that you also had a question about the announcement of the investigation, and once again, we'll continue. Charity's answer from earlier applies there. We'll have to follow back up with you as we just learned about
all new to us.
Let's see. Also from Allie with Knox News, how close are we to having enough vaccine supply to meet demand?
It's going to be a few more weeks or months, but I think that the encouraging news is everything we're hearing is that the supply of vaccine is going to continue to grow over those next few weeks and months, and that we will be able to work through that list at a faster rate as we move forward. And again, want to reiterate that the list that we have is our list, and so there are still lots of other opportunities to get vaccinated in the community. So keep an eye on the Vaccine Finder website and look for opportunities wherever you can to get your shot, and just let us know if we need to take you off the list.
Also from Allie with Knox News, now that vaccines have been in Knox County for almost 3 months, how do you think things have gone, and where do you hope we'll be in 3 months' time?
So I think things have gone pretty well, considering all the logistical challenges that come with mounting a vaccination campaign of this size, with multiple vaccines, with different rules, with getting partners on board, all of those things. Our strategy from day one has been to increase access points and to get our partners on board and doing this, being able to do this. And we're seeing that grow, and we're very happy with that. In the next 3 months, is that what the question was? So 3 months from now would what be? March, April, May, June. According to federal estimates, we might have enough vaccine to have all adults be able to be vaccinated by that point. So we hope that we continue to move in that direction and that we can meet that goal.
All right, any further questions? Please go ahead and submit them into that chat feature now. From Claire with WUOT, we're hearing that some rural counties are having a hard time filling vaccine slots. Would you ever recommend that Knox County residents travel to other counties to get vaccinated?
Yeah, I mean, you need to, again, we always say get a shot where you could get a shot. But you also do need to know that if you go get your first shot in another county, that you need to plan to go get your second shot in that county, because they will be getting your second dose vaccine into that county. So shots come one for one. And so we really need folks to get their follow up where they got their first vaccine.
Allie with Knox News asking what specifically has KCHD done to change its processes since the Pfizer vaccines went missing?
We'll have to, again, all of this just came out literally while I was in the room, I think, and we were doing this media briefing. So we will follow up on all of that soon. We need to absorb the information that was found in the report, and we'll follow up with you as soon as we can.
All right. Any further questions, please go ahead and submit them now. All right, I'm not seeing any other questions come into the chat feature, so thank you all for your time, and we hope you have a good and safe rest of your day and a good, safe weekend.